bet.
As Colorado reopens, each step carries the potential for taking us backward in the prevention of COVID-19. There is a problem, though, in setting the policies. When do people transmit the disease? Well, that is a good question.
You were sick for a time and didn't even know it.
Right. Exactly.
Teresa Perry is a survivor of COVID-19, but still affected by guilt. She could have shared it.
That troubles you, that you might have
It does
done.
trouble me. I was around my mother.
And others at places like the grocery store around Easter before she got test results back, even though she was already wearing a mask. Teresa felt fine. She got tested only because her boyfriend was sick.
You have no idea how long you might have been walking around potentially sharing it.
I would say it could have been at least a couple of weeks.
It's definitely one of the things that worries us.
Dr. Jay Finnegan is at National Jewish Health, where they are testing people who come into the hospital for other reasons.
Just to confirm that they don't have the virus. These are people who don't have symptoms.
They're finding a little under 1% who come in have no idea they have COVID-19. The CDC estimates that 40% of transmission is happening when people are not showing signs of illness.
We have pre-symptomatic people and we have asymptomatic people, and there could be a difference, right?
Professor Alan Schenkel of CSU knows they both test positive.
Both of them can be shedding the virus, and they can be potentially infectious.
Potentially, but studies aren't yet certain.
Do you think the people who are asymptomatic are equally capable of sharing disease?
It's a good question.
We don't have a lot of evidence for absolute certainty that asymptomatic people have infectious virus particles.
And another problem? Weeks after feeling better, some people still show they have the disease.
Longer, much longer in some cases, from when their symptoms start to improve and they start to get back to normal from how they feel, they're still testing positive for virus. The question we don't know is, does that mean that they're infectious?
Really, what we're doing is we're trying to get ourselves reopened, yet without really knowing the data of who is infectious and when.
Correct. That's the problem.
Teresa was pre-symptomatic and eventually did get sick with massive fatigue and dry cough. She's still being careful, and with so much uncertainty, when she sees people gathering without protecting or distancing themselves, she hopes they never get what she had.
That's tough for you to watch.
Oh my gosh, it's insanity. I can't believe that they think for a minute that that's okay to do.
Alan Schenkel says only extensive testing and monitoring of a large population of people can answer when people are most certainly contagious. And of course, we're a long way from that. Always happy to get your good questions. You can email us at goodquestion@cbsdenver.com, or you can find us on social media with the hashtag #4GoodQuestion. And another note here, Teresa has since had an antibody test. It came back negative. So this morning, there is a warning out from the CDC about antibody testing. It says most tests being used to determine if people have been infected with COVID-19 in the past may be wrong half of the time. It warns those tests aren't accurate enough to use to make important policy decisions about reopening sectors like schools or correctional facilities.